Hello, my name is Ellen Snowball, and I'm a research analyst at Toronto Rehabilitation Institute, which is part of University Health Network. As part of our Research Digest series, I will be presenting a few research studies from our Enhancing the Care of the Older Adult, or ENCORE, team. Today we are summarizing hearing screening for residents in long-term care homes who live with dementia, a scoping review by Hobler et al. The keywords for this article are aging, dementia, hearing impairment, hearing screening, and long-term care. The research questions for this article are: which hearing screening measures have been used with people who are living with dementia? Which screening tests have been used effectively for those who are living with dementia in long-term care homes? Which tests would be suitable for nurses working in long-term care homes to use? Why is this important? Hearing loss becomes increasingly common as we age. Sensory decline can have a negative impact on an individual's functioning and can contribute to frailty. The hearing needs of residents with dementia are often not recognized or addressed. Background: suitable screening tests are important for identifying the hearing needs of residents of long-term care. Individuals with hearing loss can be referred to a hearing specialist for treatment. Proper screening and referrals will improve the care and quality of life for residents. Proper screening can lead to improved functioning in older adults, reduced strain on an individual's cognitive capacities, individuals having more effective interactions, greater engagement in daily activities for residents, the ability to provide improved quality of nursing care. Methods: this study was a scoping review. It identified hearing screening tests used with people living with dementia. The review identified methods to screen for hearing loss that may be suitable for use by nurses working in long-term care homes. 193 scientific papers were included in the review. Definitions: scoping review, an initial assessment of the size and scope of research literature. It aims to identify the nature and extent of research evidence on a particular topic. Pure tone audiometry, a hearing test used to identify hearing threshold levels of an individual. The whisper test, a hearing test used to identify hearing loss in an individual through whispering. Testing environments. Testing environments reported were clinical settings, for example, memory clinics, primary care centers, and geriatric departments of hospitals, research settings, and residential settings. Testing in long-term care. Less than a quarter of the studies focused on testing residents in long-term care settings. The most frequently reported measure to test hearing in people with dementia was pure tone audiometry. Testing in long-term care. Tests that were judged to be most suitable for nurses in long-term care homes were questionnaires for the resident and staff, review of the medical records, otoscopy, and the whisper test. Conclusion: pure tone audiometry was used most frequently to test for hearing loss. This is limited in its suitability for use by nursing staff in long-term care homes. The use of tones may present challenges for residents with dementia. It may be difficult for nurses to adapt the use of the test or interpret its results without specialized training and equipment. The whisper test may be more suitable for use by nurses working in long-term care. However, it has limitations in being able to define the degree of hearing loss. Improved ways to screen for hearing loss in long-term care residents with dementia continues to be an urgent need. Please visit our website at www.encoreteam.com, where you can learn more about the Research Digest and find a PDF version. If you have any questions or require more information, please email us at ellen.snowball@uhn.ca.